Well, Michelle, at today's briefing in Downing Street, Chancellor Rishi Sunak said that the Prime Minister's situation was a reminder for us all of how indiscriminate this disease is. Nearly everyone, he said, will know someone who's been affected, and that this is a terrible virus that respects no boundaries. And on Mr. Johnson's health, he gave a brief but encouraging update. Here's what he told us.
People, I'm sure, will also want an update on the Prime Minister's health. He is receiving excellent care from the NHS team at St Thomas's. The latest from the hospital is that the Prime Minister remains in intensive care, where his condition is improving. I can also tell you that he has been sitting up in bed and engaging positively with the clinical team. The Prime Minister is not only my colleague and my boss, but also my friend, and my thoughts are with him and his family.
So Mr. Johnson apparently still doing well, but still in critical care in hospital. A lot of good feeling for him around the country, with people transforming the applause for the NHS that has been happening some evenings into applause for Boris. Certainly plenty of people in the country, even those who didn't necessarily vote for him in that recent general election, wishing him well, speedy recovery, and hoping he'll be back to leading the fight against coronavirus soon.
Yeah, we all do indeed wish him well. Look, Jonathan, the government has already announced financial support for individuals and businesses, provided that their annual income is below a certain level. Today, they said that they're also going to offer help to the charity sector. So what are the details on that front?
Yes, Chancellor Rishi Sunak chaired the Downing Street briefing today and spoke about the social impact of the crisis. He said that it had emphasised how all of us depend on each other. He said, when you need it, when you fall on hard times, we all as a society need to be there for one another and to take care of one another until once again everyone is ready to take care of themselves and others. That idea, he said, has been central to all of the government's efforts to support businesses and people during the crisis. And building on the government's plan to support the economy, it now says it will do its part to support Britain's social fabric. Mr. Sunak said that there are nearly 170,000 charities in this country. And while the government won't be able to match every pound those charities would have received this year were it not for the crisis, all charities can use the existing schemes that the government's already introduced, for example, furloughing their staff, with the government paying 80% of their wages. But the government, he says, realises that some charities exist precisely for moments like this crisis to support those in need. And so today he announced £750 million worth of funding for the charity sector. £370 million of that funding, he said, would support small local charities working with vulnerable people. Mr. Sunak said that the government will also match pound for pound any money raised by the BBC in an upcoming telethon that they'll be running. He spoke about the invisible connections in society, which often run through charities, saying that those are the connections where individuals help one another in society, and that this gives us hope and makes us stronger and reminds us what we depend on from each other. Above all else, the Chancellor said that protecting lives was the priority, but that the government was putting in place measures to try to mitigate as much of the economic impact as possible, so that once the country gets through the crisis, he said, it can bounce back as quickly as possible. And he acknowledged that all these measures will have a significant impact on the economy, saying that while the government can't save every single job or every single business or every single charity, he is trying to put in place as many targeted efforts as possible to save as many as possible.
Jonathan, how are the figures looking now? Does it look like the lockdown measures have been working? Has there been a change in trend in terms of new cases registered and in terms of those people needing hospital care?
Well, at that Downing Street briefing today, it's a daily event now, we saw the graphs that they show every single day to illustrate the effects of the lockdown rules. And today they showed one of footfall in national rail stations, which they said was down 94% by the end of March, which is a measure of how effectively the new rules have impacted the rate of new cases in the UK, because obviously if fewer people are moving about, fewer people are spreading around the virus. That rate is not accelerating, they said, the rate of new infections, which is good news. When it comes to the rate of hospitalizations, the graph's a bit slower to react to the social distancing and lockdown measures, because people end up in hospital only once they are really in a relatively serious condition. So there's a bit of a lag. But even the rate of hospitalizations, they say, is now slowing down. And the aim is to ensure that that rate slowed down enough to allow the healthcare service to have sufficient capacity to accommodate all those who need hospital care. Across the country, in the last 24 hours, the number of patients requiring critical care has increased by only 4%. In some parts of the country, it's actually started to flatten, including London. When it comes to the number of deaths, the data still don't reflect the tight social restrictions because of the way in which deaths are counted. That's got a bit more of a delay, quite a few days worth, because that means that those deaths aren't necessarily counted on the day they happened. So we won't see that curve flatten until sometime after the graphs showing hospitalizations and positive tests do. The lockdown was due to be reconsidered after its first 3 weeks, which means that it is meant to be assessed next week properly. There will be a COBRA meeting tomorrow to discuss it, but the government said the review must be based on the evidence, and that data isn't yet available. So it seems that it's likely the lockdown can't be lifted yet. But they won't comment further at this stage, they said, except to say that right now everyone must follow the current advice to stay home, slow down the spread of the virus, and ease the pressure on the National Health Service. And the government insists that that decision to withdraw some of the lockdown rules will be made based on evidence, and they need to wait for more data before they can change anything.
All right. Jonathan, thank you so much. Stay home, stay safe, and happy Passover. Jonathan Sacerdoti live for us in London tonight.